Our recent patient had 2 simultaneous basal cell carcinomas on his scalp. One of the cancers spread subclinically within the skin without any visual signs of its spread.
Careful mapping and surgical precision is absolutely essential.
At the Skin Cancer and Reconstructive Surgery Center in Newport Beach, curing skin cancers with Mohs surgery begins first thing in the morning. Mohs Day, as it is known at SCARS, is usually finished by noon, when patients go home cancer-free and fully reconstructed.
Once I remove that sample, we'll take it to the laboratory. It takes probably about 30 minutes or so. We'll process that.
For Dr. Jonathan Barron, an experienced dermatologist and Mohs surgeon, curing skin cancer with Mohs is just an average Monday.
Being here in Southern California, with the sun exposure that most of our residents get, there's a high incidence of skin cancer. So treating patients with skin cancer has been a passion of mine, something that I've been very, very interested in, and being able to utilize the Mohs technique is really been helpful for me as a dermatologist to ensure that we can provide the best care to our patients.
The Mohs procedure begins with an excision, or a surgical removal of the skin cancer. This area usually consists of a visibly affected area and a thin portion of healthy skin known as a margin.
The technical advantage of Mohs surgery is that it allows us to start cutting out a common skin cancer, such as basal cell carcinoma, with a narrow strip of skin and underlying tissue beyond the apparent evident edge of the skin cancer.
The margin, usually around 1 millimeter wide, is taken to assure there is no residual skin cancer left on the patient.
So as I tell patients, it's a maximum chance of cure for the smallest possible hole.
The excised skin is then placed on a petri dish, and the Mohs dermatologist labels it to show the sample's orientation on the patient. If any additional cancer is found, the dermatologist knows exactly where to remove more tissue. The excisions are then transferred to the on-site Mohs lab, where a technician processes the sample. First, the tissue is painted to mirror the marks made on the patient and to confirm orientation. The Mohs procedure uses a technique called frozen sectioning, where a sample is suspended in a gel that, when frozen, has the same density as the frozen tissue, making it possible to cut incredibly thin slices using a special machine.
A machine that freezes it. It's sort of like a glorified, but much more expensive refrigerator. And then it has essentially a bologna slicer in there that, again, much more expensive and finer cutting.
Each slice is just a few microns thick, and the Mohs technician chooses the most well-defined layers to place them on the slides, making sure to get a diverse cross-section of the sample. The slides are briefly soaked in a sequence of dyes and rinsed in alcohol. The dye helps to accentuate the areas of skin cancer and make the dermatologist's job a little easier. Finally, the dermatologist examines each layer of the sample under a microscope, searching the edges for signs of cancer outside of the margins. If the cancer is found on the edges, they will return to the patient and take more levels until the area is declared cancer-free.
The Mohs procedure is an undeniably effective way to cure skin cancer, but an extreme and unusual case can take Mohs micrographic surgery to its absolute limit.
Our recent patient had a very complicated basal cell carcinoma history. He's already had multiple skin cancers, and he presented to us for treatment of 2 simultaneous basal cell carcinomas on his scalp.
The cancers are first excised by Dr. Mark Jewell, slides are made, and the samples are examined. The hope of the dermatologist is always to see little to no cancer after their first level. However, this is no ordinary basal cell, and it quickly becomes apparent that Dr. Jewell will need to take additional levels to remove the cancer completely.
I started on 2 superficial basal cells on the scalp, His were very clinically not apparent. Clinically means when I look at the scalp, they're not obvious for the most part. They're difficult to see. And the only way you can really see if it's tumor is to do Mohs and to look at the slide.
From this point, the Mohs cycle repeats as Dr. Jewell takes level after level. He searches the edges of each slide, tracking the cancer deeper into the skin. "8 hours into the procedure, and it seems the margins are finally clear."
It took an amazing 6 levels to clear the cancer margins. In other words, the cancer cells, the tentacles of the cancers were spreading that far.
Just as they begin to finish the procedure, the Mohs surgeons discover something startling.
If 6-level Mohs defect was not enough, Dr. Jewell, to my surprise, told me there was yet another cancer he just diagnosed in a frozen section.
Having done a 6-level Mohs already, the scalp left to work with is dwindling. The surgeons must take just enough scalp to fully cure the cancer, but they also need to make sure to leave enough to make the reconstruction possible. The third cancer is excised and sent off for permanent pathology. However, more suspicious lesions are found on the patient's scalp, and the physicians begin to consider other options.
So Mohs surgery is one of the most successful and efficient ways of surgically managing skin cancers. However, with that many skin cancers on this patient's scalp, we're really running out of room to do reconstructions and running out of scalp skin.
With this many basal cell carcinomas and little information about just how deep they could go, the physicians decide to reconstruct the defects and plan another form of treatment for the remaining cancers.
Mohs, I think, has its place. It's not a cure-all, and there are limitations to what is really the best way to do margin control. Some tumors are not very cooperative, if you want to say it that way.
In this case, the Mohs process has technically ended, but for the scar center and the patient, the journey is far from over.
So at that same day, with the patient, we discuss multiple other options available. And there are. And that's one of the advantages of our organization, is we frequently get together multiple specialists and we brainstorm what would be the best treatment plan for the patient.
The patient's case is presented at the monthly skin cancer conference that the Scar Center holds, where many of the most talented and qualified physicians from Orange County offer treatment options and brainstorm the best possible outcome for the patient. But before alternative treatment can begin, the Mohs defects must be closed, and reconstruction, the final step in the Mohs process, must be carried out with extreme precision.